Okay, thank you so much, Leslie, and thank you for inviting us to be here today. I have enjoyed kind of getting to know this new virtual world, and I appreciate those of you who are live with us, and then those of you who are going to be looking at this a little bit later. My name is Vicki Rose, and I'm the Memory Disorder Clinic Coordinator at Tallahassee Memorial Healthcare. So kind of I I work at one of the state's 17 memory disorder clinics. We are actually funded through a grant through the ADI, or Alzheimer's Disease Initiative. So that's I guess a pot of state money that they've kind of put down into these various memory disorder clinics, as well as other programs for people living with Alzheimer's and other types of dementia. So as one of the state's 17 memory disorder clinics, that means that we kind of have a service area. Mine is PSA 2. So that means that I'm serving Calhoun, Gulf, Liberty County, Gadsden County, Franklin, Wakulla, Leon, Jefferson, Taylor, and Madison counties. So that's my service area, meaning that I go out and do outreach and education and talk to clinics and providers out in those areas. But that doesn't mean that someone from Jackson County or someone from Bay County couldn't come to our clinic here at Tallahassee Memorial. People do that all the time. Sometimes it's just more convenient to come to Tallahassee rather than to go out to the next memory disorder clinic, which is in Pensacola, Florida. So those are our two in the Panhandle. But like I said, there's 17 of them across the state of Florida, and they all provide kind of the only thing that's similar about us is that we all provide outreach and education. We do diagnostic and support services. So the diagnostic piece is really important in the state. I think it's great that the state has set up a network of these clinics to do that diagnostic portion, because that a lot of times it's almost the first step in the journey, is figuring out what is my diagnosis, what am I dealing with here, so that I can get the resources and things and plan for the future in place right when you are diagnosed. So that's the unique thing I think about the memory disorder clinics is that they have the diagnostic portion and then they have the support portion, which we'll kind of talk about here in a minute. In our specific memory disorder clinic, they're all staffed a little bit differently and they all kind of run differently. But here at our clinic at Tallahassee Memorial, we have 4 neurologists. Neurologists are the primary people that do the diagnostic stuff and the testing. We have 2 neuropsychologists, which kind of help the neurologists figure out exactly what's going on in the brain, what is causing this person to have problems with their memory. There's 2 social workers, myself as the clinic coordinator, and then we have another social worker in the clinic who spends most of the day talking with patients and making sure that everyone has what they need. And then also our support staff. So of course at our office, just like any other doctor's office, we have the MA, the office coordinators, our front desk person. All of that kind of makes up our office. So there's 2 ways to get in our clinic if we're going to be talking about patient flow. So if a patient comes and goes, oh, I'm having problems with the memory, what should I do? So they can come to our clinic either with a referral from a doctor. So you go to your primary care or a doctor that's overseeing your care and go, I'm having problems with my memory. I would like a referral to the memory disorder clinic, and they're able to do that. With our clinics, the clinics all across the state, you're able to self-refer. Everyone's process looks a little bit different. Our self-referral process is that I send you a small stack of papers. You fill them out and give them back to me. One of the stacks of papers is a release of information from your current doctor. So you will go and give me those papers. I will get the records released from the doctor for our doctors, our neurologists, to review here in clinic before they're able to see you. Right now, we just had our call. The memory disorder clinic coordinators all meet once a month via phone. And there's a lot of really interesting things happening in the clinics. They're doing a lot of virtual support groups. Research has started back up, which is great. I didn't even think of that being a side effect of COVID, is that research studies had to be put on pause, especially with people coming into places and doing testing. That had to be put on pause, but a lot of research is coming back, getting back online. And then also our brain bank. So our brain bank is an interesting program with the memory disorder clinic, as it allows people to donate their brains to science. Right now, the brain bank is looking for healthy brains, as well as brains that are affected by Alzheimer's and other types of dementia and other neurodegenerative diseases. So they are really, there is a process in order to donate your brain, and any memory disorder clinic is going to be able to help you navigate that process and get you in contact with the right person in order to do that. Could we switch to the next slide? Oh, no, we're good. We're good. Current activities. That's great. So here in our clinic, some of the activities that we have going on right now is that we've started to see patients back here in the clinic, especially new patients. A new patient appointment is about an hour. Our follow-up patients have been doing some telehealth, so they're able to log onto an app and talk with the doctor over a Skype call, kind of like we're doing now, only they'd use a different software. So we are seeing both. We're doing a hybrid. We see people in the clinic and the telehealth. We also do telephone support for patients, caregivers, and community members. So just because you're not a patient right here at the Tallahassee Memorial Memory Disorder Clinic doesn't mean that you can't call me. Even if you're down in Miami, call me, because I can at least point my finger in the right direction and get you set up with that care and support that you need, even if you're in Miami or wherever, South Florida. So it's really important too for our community to know that they can call me and use me as a starting point so that we can connect you with the resources you need. Right now, we're actively recruiting for our next virtual Powerful Tools for Caregivers class. This is a 6-week evidence-based class that we're doing all on virtual. It's not necessarily just for dementia caregivers. If you're taking care of another human, you are eligible to participate in this program. The main tagline is that we aim to help caregivers thrive while caregiving, not just survive. So if that's something that you're interested in, please let me know. You don't have to be in the Big Bend area. We had someone join us last time from Nova Scotia, Canada. So we're pretty flexible with that as well. So if you're interested in virtual Powerful Tools for Caregivers, we also do virtual dementia tours, which is an experience that kind of inundates you to be in the shoes of a person living with dementia. And then also we do outreach and education in the community. Most of the time I went out in the community and did things, but now we've been moving a lot to virtual. So if you have a group that needs training or anything, please let me know. I'd be more than happy to set something up either in person or virtually. And that's really all I had. I think that I can maybe put my contact information in the chat box so that you all can call or email me. And I really appreciate the time today. So Laura, I think you're up next.
And thanks, Vicki. Before Laura starts her presentation, I just want to thank you all for joining us today. If you joined a little bit after we started and you're not participating online, don't worry. We'll share the PowerPoint slides and the information with everybody after this call, and I'll make sure that everybody has Vicki and Laura's contact information. So thank you again, and then once Laura finishes, we will open it up for questions. So if you have any questions, hold on to those for just a moment. So Laura is taking over as presenter, and when that slide pops up, Laura, you'll be ready to go. Thanks so much.
Okay. Do you all see the Dementia Care and Cure Initiative first slide on your screen?
Yes.
Yes.
Okay. Well, great. I'm Laura Copeland. I'm with the Florida Department of Elder Affairs, and I'd like to extend a thank you to everyone who is participating today and to Leslie Spencer, at AARP for inviting me to join you all this morning and to tell you a little bit about what I do. So I'm with the Department of Elder Affairs, and I am our program coordinator for the Dementia Care and Cure Initiative. And this is an initiative that was started at the Department of Elder Affairs in 2015 in response to the rapidly increasing incidence of Alzheimer's disease. We have not seen it slow down in the state of Florida or nationwide. It's a public health crisis really in Florida and nationwide, and we have the second highest incidence of Alzheimer's in the state of Florida, only second behind California. At this time, we have approximately 580,000 individuals living in our state who have a diagnosis of Alzheimer's disease, and here in Leon County, we have approximately 4,578 people living with Alzheimer's disease. In just 5 years, so by the year 2025, it's estimated that approximately 720,000 people will be living with Alzheimer's in Florida. And currently we have over 1 million unpaid caregivers in Florida that care for a loved one with Alzheimer's or another form of dementia. These statistics, when the 580,000, 720,000 people, that only accounts for Alzheimer's disease, not other types of dementia. So there's a lot that we can be doing in Florida, and this initiative was created as a means to do something about that. All right, so the goals of the Dementia Care and Cure Initiative are to increase awareness of dementia and of services and supports for those with dementia, their families, and caregivers. So really anyone who is impacted by or affected by dementia, this works in your favor. This goal is accomplished through educational events, the media, joint efforts with community leadership and stakeholders. We also work to provide assistance to dementia caring communities. So dementia caring communities, I'm going to tell you about those in a minute, but they're autonomous in the work that they do. However, the work that they do is supported by the Department of Elder Affairs. They produce and implement community-specific, action-oriented plans, and we are there to back them at the state level. And lastly, the last goal is to continue advocacy efforts for care and cure programs. So we encourage the advocacy for funding of programs that care for both those diagnosed and those caring for someone with dementia, as well as for research efforts that work towards finding a cure. And a lot of our research currently in Florida is being done where Vicki works and throughout the state at our 17 memory disorder clinics and the Florida Brain Bank. So here in Florida, we have what are known as dementia caring communities. We currently have 14 of these throughout the state. Tallahassee was named as the pilot project or program for the Dementia Care and Cure Initiative in the spring of 2016. And since then, we've had 13 new communities come on board. The Dementia Care and Cure Initiative, or you might hear me call it DCCI, it's organized throughout the state by task forces. And these task forces are typically led at the top by leadership from the memory disorder clinic and the area agency in that area. So our own Vicki Rose, who you just heard from, she is one of the leads for the local task force that's located here in Tallahassee that covers the area of the Big Bend. And then her counterpart is Lisa Bretz with the Area Agency on Aging for North Florida. They're doing business as Advantage Aging Solutions. So the task forces, they are volunteer run, they're volunteer led, and there are boots on the ground. They're the ones in the community doing the work. One of the unique things about this initiative is that it is state directed but community driven. So the real work is being done in these 14 communities throughout the state where you see those stars on the map, and they are the ones who are assessing what the needs are in their community, and then they work to address those needs. And then this graphic depicts our training trajectory, or some call it a wheel of interaction, and these touch on the areas of a community where awareness and sensitivity about dementia can be spread to encourage safe and inclusive communities for all who seek to continue to be engaged throughout their lifetime. So we want people to really understand that if someone is diagnosed with dementia, that person can still live a very productive, purposeful, active life. And so a big part of what task forces do is to provide free dementia sensitivity training, education, awareness to different sectors of a community with the hopes that they're going to make that community as a whole dementia caring, or really more hospitable to people living with or impacted or affected by dementia. And these sectors, they're not inclusive of every single entity you might see under that sector, but it's just just a broad depiction. So that's what we're working on at the Department of Elder Affairs. There is opportunity to get involved if anyone here locally is interested in joining the task force efforts. The task force meets monthly, sometimes every other month, typically the last Friday of the month here in the Big Bend, and you're welcome to reach out to myself or Vicki, and I'll put my contact information in the chat box as well. Leslie with AARP, she's a member of our task force up here in the Big Bend, and it's just a great effort to respond to and help those individuals who are impacted with dementia statewide. And I also, before I end my time today, would like to tell you all a little bit about some other initiatives that DOEA, or the Department of Elder Affairs, has created in response to COVID-19. These initiatives are in place to help individuals who are living with Alzheimer's or another form of dementia, and they're at home right now. The social distancing efforts, I know, have taken a toll on many people with social isolation. So these initiatives started by the Department of Elder Affairs are aimed to, really help combat that social isolation factor and bring peace and comfort and companionship in an aspect to our seniors in Florida. So the companionship comes in the way of therapeutic robotic pets. This can be either a cat or a dog, and these robotic pets mimic real pets. They're furry, they're soft, they bark, they meow, they move. They're great for people, older adults, or really adults living with any form of dementia, or really just anyone who's social isolating who might want to receive the benefits of pet therapy. We're also offering MP3 players that come with preloaded music, with musical genres ranging from patriotic and country to Broadway tunes and gospel. These MP3 players were donated by the Alzheimer's Association in Florida, and they're being mailed directly to the house of whoever requests these items. So again, you can request an MP3 player, a robotic cat, or a robotic dog. These are all free of charge, and you can do so by visiting the Department of Elder Affairs website and going to the Livable Florida tab. And on the left-hand side of the top left-hand side of the page, there's a link to request one of those items. And I found out yesterday that if you do request a cat, dog, or MP3 player, you will also get a scent preservation kit. And a scent preservation kit, we've partnered with a company called Scent Evidence Canine. They're out of Tallahassee, but they work worldwide. And they have created something called a scent preservation kit, and it's a science grade jar that you collect a human scent and you store that scent. It's on medical grade gauze. You store it in that jar, and it's good for up to 10 years. People living with dementia do have a propensity to wander, especially now that everyone's at home. People may be more inclined to try to walk out of the door or get in their car. So these scent kits are being distributed to individuals throughout Florida. I know the department ordered 2,000 of them. So if you order a cat, dog, or MP3 player, you'll get one. But if you are not interested in a cat, dog, or MP3 player, you can request one of the scent kits by emailing livablefl@elderaffairs.org. And if you'd like to read the press releases about these initiatives, visit elderaffairs.org in Florida to read about all these initiatives. Or if you're not currently subscribing to our Livable Communities newsletter, I know a new edition came out yesterday, and it's an electronic publication that comes out bi-monthly. Again, to subscribe to that newsletter, you can also email livablefl@elderaffairs.org. And I think that's all I have. Thank you.
That was awesome, Laura and Vicki. Thank you so much. You gave a lot of information out to folks. And before I open or unmute the lines for people to ask questions, I just want to reiterate that we'll be sharing all of this information that was talked about today with attendees after the call. I'll send out the PowerPoint. I'll send out all the links that both Vicki and Laura mentioned, so that if you're interested in availing yourselves of these resources, please do so. I had a question or two, but I want to give folks who may have a question the opportunity to do so. So if you want to unmute yourself to ask a question, please feel free to do so. Or you can put it in the chat box, either way. Okay, well, I have a couple of questions that I was thinking about when you were both talking. So, Vicki, first for you, I heard you mention that the Brain Bank is looking for individuals to donate their brains for science. I think I heard you say they're also asking for healthy brains. Did I hear that correctly? Oh, and Vicki, you're on mute, so you may want to unmute yourself.
Can you hear me now?
Oh, yes, I can.
Okay, very good. So yeah, the Brain Bank is looking for healthy brains as well. They like to get the healthy brain because they like to be able to compare the healthy or typical brain versus a non-typical or Alzheimer's brain. So yeah, and that's one research project. If people are really interested in research, the Alzheimer's Association has a wonderful program called Trial Match, and I've gone on and done it. And you go and you fill out like a short survey about your demographic information, and then they put you into a database so that you're able to volunteer for research studies. So, I've never received a call for anything, but I'm in that database, and, it might be a research study from the University of Oregon, and they want you to fill out a survey about something, and they're trying to collect data like that. So if people are really interested in research, they can be connected with the Brain Bank in Florida, of course, but also Alzheimer's Association has a trial match program that you can register for as well.
That is phenomenal. Thank you for sharing that.
Yeah.
Appreciate that. Good to know. Good
Thank
to
you
know.
so much.
Sure. And then Laura, I know you mentioned a lot of the things that the Dementia Care and Cure initiative does in the community. And one of the things that I always found fascinating and so positive is that you go out in the community and train folks who may be small business owners or restaurants or first responders. Do you want to share a little bit more about what that looks like and what's happening across the state with those trainings?
Sure, thank you. So with the Dementia Care and Cure initiative, we do have a pretty standard training that was developed at the Department of Elder Affairs and is given to each of our task forces, and they then have the option to customize it and really make it specific to not only their community, but whatever audience they're presenting to. So as Leslie mentioned, first responders are a big part of who gets trained with dementia sensitivity training. Their training is going to look a little different from a restaurant's training. But again, all these entities fall into that training trajectory graphic that I showed you. They're different parts of a community, and together, when all of these different entities are trained, that's when our community becomes dementia caring as a whole. A lot of task forces have created very specific trainings for businesses, for restaurants, for first responders, and it's been very cool how receptive community entities throughout the state have been to receiving this information. More often than not, you walk into a room full of people and you just ask the question, who in here has been impacted by or knows someone who's living with dementia? And there are so many hands in the room. Everyone, and pretty much everyone that you'll come in contact with has been touched by this disease in some way, shape, or form. Vicki and I did a training in early March to a moving company here in Tallahassee, and it was a room of 18 men, and the stories they told, it was just incredible. They opened up, they shared with us what they've experienced out in the field when they're moving people, but also with their personal lives, who they've helped care for in their families, or who they've met, and who's like, it's always very impactful and incredible. We're teaching and we're educating people, but as the facilitators and as the educators, we're also learning so much from the people we're presenting to, because they always have so much personal experiences and wisdom and advice to share with us. So it's been very, for lack of a better word, great or cool to see across the state how this initiative has worked, and it's been very organic. We're not funded. This program is not in rule or statute. It's just really, run through the goodness of people sharing their time, talents, and efforts and hearts with their communities. Again, our task forces are incredible, and that's where the bulk of the work for this initiative is occurring. So thank you to everyone who participates. And then two, if a business wants this training, they can always email dcci@elderaffairs.org, and I will get them hooked up or linked to their closest task force.
Wonderful. Thank you, Laura. And I think the thing that's so important for us all to remember is that when someone starts becoming a caregiver, they can become isolated themselves. And so having this training out for the community businesses, for restaurants, enables a caregiver to maybe go to that business because they know that the staff and the owners there have had that sensitivity training, and they would not necessarily be surprised if an individual acts a certain way, and they would know how to handle that. So I think that's such a key part of what you do. Thank you so much.
Thank you.
Did anybody else have any other questions or comments, thoughts they wanted to share with Vicki or Laura today before we sign off? Well, I want to thank you both for joining us today. The information you gave us was so wonderful and so important for caregivers and families and professionals alike to know about. This is a reminder, if you know somebody who would have liked to participated on this call but couldn't, we are recording it, and it will be posted on our website at aarp.org/Florida for future viewing. And again, I'll be sharing the information about today's call with registrants and participants later on this afternoon. So without further ado, I want to thank Laura and Vicki for being with us today. Thank you all for participating. Have a wonderful afternoon.
Thank you so much. You all too.
Thank you. Take care, everybody.
Thank you.
Thank you, everyone. Thank you.
You too.